two things that are kind of like side by side. If they ask you of one, they always ask you for one. Okay, so this is what is known as a small for gestational age and large for gestational age. Small for gestational age is abbreviated SGA. Large for gestational age is abbreviated what? LGA. Okay, so they just ask students in our examination, they say write short notes on the following: small for gestational age, large for gestational age. So for this, there's the lecturer is obviously looking out for some one or two things. Do you understand? And it's also trying to see if you indeed know the differences. So we'll discuss them one by one. Okay, then from there you get to see the differences. So small for gestational age is just an infant whose birth weight is below the 10th percentile for the gestational age. Do you understand? Are you getting? Like the age, okay, but the weight is, let me just get something for you guys. Like a baby was born at 36 weeks. Okay, what's the 10th percentile of 36 weeks? 10% of 36 is what? 3.6, right? So if the birth weight of that baby is less than 3.6, we say that the baby is low for gestational age. If the baby was born at 40 weeks, what is the 10% of 40 weeks? It's 4 kg, right? 4, so it's 4 kg. If the weight of the baby is less than that 4 kg, you say that the baby is small for gestational age. Okay, so it may be symmetrical, all the body components are small, or it can be asymmetrical, like some parts are large while some parts are small. Mostly maybe the head is large, okay, other parts are small. Causes could be maternal factors like malnutrition, hypertension, smoking, infections like the touch infections, then the substance abuse. So placental factors, it could be placental insufficiency, enough blood was not reaching the baby, abruption, and also infarction. Then fetal factors could be chromosomal abnormalities, all those congenital issues. Okay, so complications, it could lead to perinatal asphyxia, could lead to hypoglycemia, hypothermia, polycythemia. Then on the long run, it leads to what? Growth retardation, neurodevelopmental delays, increased risk of metabolic syndromes in adulthood. Okay, so let's go to the large for gestational age now. Large for gestational age is an infant whose birth weight is above the 90th percentile for gestational age. Okay, it's above the 90th percentile for gestational age. So it's often referred to as what? Fetal macrosomia. Okay, this is when the birth weight is more than 4 kg or 4.5. Okay, so causes: maternal diabetes, maternal obesity, genetic predisposition. So it could just be that you people in that family, everybody's just large. Then post-term pregnancy. So it could be that the mother has carried the pregnancy, gone past the normal time that the baby was actually scheduled to be there. So complications: birth trauma. The baby can now be too big for the birth canal, leading to things like shoulder dystocia, brachial plexus injuries, fractures, hypoglycemia too, respiratory distress, and there's increased risks of childhood obesity and also metabolic syndromes. Okay, so most of these complications are childbirth. They usually follow the person till, okay, so you have to be very careful when delivering babies. Okay, so for most of the people who are suffering from some people behaving somehow, our lecturer will say that it's because of birth asphyxia. Okay, and we usually laugh over it, but the matter is actually serious. Okay, so if somebody had issues with their brain while being delivered, of course they can be a nuisance to the society, okay, as they grow.